Talofa lava, bulavanaka, maloilele, kia orana, kia ora tātou katoa. The title of my presentation this afternoon is fofo le Alamea, finding solutions within primary care to reduce Pacific health inequities, a co-designed Pacific intervention. I think my talk follows nicely after Diane's one. So basically I'm going to talk about a co-designed Pacific research model that we've been working on here in Auckland, in South Auckland, how we can work together with university, with our PHO and also community groups. And I'll mention our Pacific Gout Intervention project that we're working on at the moment and just finish off with some key messages. The Māori proverb or the whakatoki, he aha te mea nui o te ao, he tanata, he tanata, he tanata. If you ask me what the most important thing is in the world, it is people, it is people, it is people. The reason I absolutely love everything about general practice is because of the people. But what I find most difficult is dealing with the health inequities and the impacts it has daily for the patients that we care for. So I constantly ask myself, how can we do better in this space to reduce the inequities gap that exists for many Pacific patients that we have in our practice, and we have over 90% of Pacific patients. And it seems to be highlighted since we've had the COVID pandemic. It can be challenging, it can be complex, but it's also very rewarding, the work that we do. I am part of the statistics as a Pacific patient with comorbidities, but then I'm also part of the solution as a clinician and a community person. Hence the concept of fofo le Alamea, that speaks to the starfish that can heal itself, or it translates into finding solutions within our own communities. This is where I believe and advocate that co-design has a significant role in addressing and finding solutions for health inequities in Pacific people, but all people in Aotearoa. So this is the research model that I've been part of for the last few years, and it was an initiative from Professor Felicity Goodyear-Smith, who was at the time the head of Department for General Practice at University of Auckland, and as well as the chair for NAPCRG. Dr. Tana Fishman was a GP and clinical director for our PHO at the time, and Rose Lamont was her patient. They traveled to America to attend this PACE workshop, or many of you may be aware of patient-clinician engagement workshop. And they talked about co-design using clinicians and patients. And from here, they were inspired to return to New Zealand to start their own group in South Auckland. In 2017, 2018, Alliance Health Plus PHO, which is the only Pacific PHO in New Zealand, together with University of Auckland, supported the development or establishment of the Pacific People's Health Advisory Group, otherwise known as PHAG, and the Pacific Practice-Based Research Network, which had research offices, and which is how I became involved as a GP at South Seas Healthcare at the time. The guiding principles of the co-design basically emphasize collective approach and focus on the importance of reciprocity in relationships. And through their research questions, they generated topics that they thought were priority to Pacific people. And the top two that they came up with was gout and rheumatic fever, for which I'll explain a bit more. So this is the group. This is one of the research workshops that we had over the last 2 or 3 years. The people are made of Pacific people from around the community here in Auckland, and also GPs, practice managers and nurses. And we come together at least 3 times a year to have these workshops to work on our research project. In 2019, HRC gave us a grant to carry out a systematic literature review on gout interventions from overseas, and this was carried out by our master's student from university. And this year we've just completed our seed activation grant, looking at Pacific gout interventions here in Aotearoa. And this was led by myself and Dr. Hina Mahalutui, who's the current clinical director at Alliance Health Plus. We also managed to secure funding from HRC for the next 3 years to carry out our Pacific Gout Intervention project. And I want to pay tribute to our research team that has been mentioned here, Dr. Malakai Ofanoa from University of Auckland, who's our principal investigator. And it's exciting to be able to do this in the co-design space. I wanted to mention also that we have funding for a 1-year project to look at rheumatic fever intervention project, and that will begin next year. This is the paper that was published last year, the systematic review that was carried out by our master's student. And so you might want to ask, why is it so important? Why is gout so important to us as Pacific? Well, as we know, the prevalence rate of gout, we have one of the highest prevalence rate of gout internationally. If you look at the New Zealand statistics, almost 15% of Pacific over 20 years old have gout, and that number increases as they get over 65 years old, being 50% of Pacific. We know it's causes debilitating pain. It can cause long-term effects on joints, the associations with cardiovascular and renal risks, but also to the mental, the psychological, the physical impact that it has on people that have time off work, that miss functions, being able to put food on the table. All those things are really something that we see each and every day and really difficult to deal with. And again, this just shows why gout is so prevalent in our Pacific people. They're likely to get it at a younger age. They're likely to be hospitalized more than 9 times. They get it more often. They often depend on having non-steroidals, and they're less likely to be taking long-term medications. And so this is why we looked at Pacific gout interventions. We wanted to do something that was solutions from our community as well as from our clinicians. We looked at the international evidence overseas and also to what was available here in New Zealand. But what we found that many of the New Zealand interventions, it was only pockets of groups that would do it. It wasn't widely used, it wasn't consistent. So we wanted to come up with something that would be more consistent and Pacific focused and Pacific led. A few weeks ago, we had our gout workshop, and this is basically the question that we came up with was trying to ask them, what are the key things that are important about having gout? What are some of the interventions? What are the things that would be important in your groups? And basically feedback came back with this. They wanted to see a Pacific model of health, whanawhale, which I'll mention a little bit later, but encompassing Pacific values was really important. And I think that was one of the key things that came up. One of the other things that came up was Pacific gout community, establishing Pacific GPs, nurses, pharmacists, health coach, patients and family, and also specialists, that they could have a regular Zoom or meeting that they could discuss issues around managing their gout. One thing that did come up was providing a multifaceted intervention. And one of the key things that came up was education, also that accessibility to clinics, to specialists, to nurse practitioners, nurses, to be able to manage the gout safely. Monitoring was another question that the group discussed in terms of, regular blood tests versus point of care testing, and where would that be? Who will lead the intervention? Again, this came up down to having multiple people being involved in this, and it was one thing that was really important was around Pacific data sovereignty. So the whanawhale model is a model of care, and it's basically a system of well-being that was developed by Carl Pulutu Enderman, who has a background in psychiatric nursing and has been a Pacific leader and forefront of a lot of research and a lot of training in New Zealand. And this is basically a concept that encompasses all our Pacific values in terms of the family being the base, the culture that's overlining, and then you have the physical, spiritual, mental, and other. As you can see around, you have context, time, environment, and those are dynamic and that can change. But I think all of these values are so important, and I think it's important to bring it into research, but also too when you're dealing with Pacific people, because these are values that are really important to us. So what we found in our workshops is there's no one size fits all management for gout. We know that there's multiple comorbidities that can be complex. Education, awareness, health promotion, a lot of incentives to help people increase their awareness about gout and gout management and why medications are important were some of the key themes. Also finding solutions that had people who were champions that were engaged and that could help push the message around gout and taking medications was important. But also to the financial aspect, the social aspect, the psychological impact of gout on Pacific people was one of the main issues that also came up in our discussions, research. So what are the next steps for our project? Looking at phase 1, at the moment we're looking at getting data sets or quantitative data sets from 4 PHOs here in Auckland. We will also look at national data and data from the various DHBs from around the country. Phase 2 will be about designing the intervention, and then phase 3 will be about evaluating the intervention. So I guess in terms of support the pathways between research and policy and practice in New Zealand, I would like to see equity. So something that is fair for people here in New Zealand, especially our Māori and our Pacific people, a collaborative and a collective approach that involves everybody from all levels and all agencies and organisations, and that we work together. Having a roadmap that's clear pathways for how that we can do this, also to looking at ownership around Pacific data sovereignty. I think the one key message that I would like to say from general practice is it's got to be something that's doable, something that's practical, something that's applicable and it's relevant to primary care and our communities. Because at the end of the day, we can set out strategies, we can have interventions, all these things, but if it's something that we can't apply to our community, to our patients, then it's pretty difficult. And I think we've seen that in some of the health inequities over the years. You know, one example is looking at diabetes, and we haven't had a change in our prevalence rate in South Auckland for the last 11 years. It still hasn't really changed. So I think if we're going to work on interventions, we've got to do it as a co-design. We've got to have our community, we've got to have our clinicians, we've got to have all the different agencies working together that we can provide something that is doable. And for the future, this is something that I really feel passionate about, is that we have a commitment to increasing and supporting Pacific Health teaching, training, research, and workforce capacity in New Zealand. And my final word, upu whaiu, e wawe tau nuu le malanga pe a tātou alofa whātasi. Our destiny is within sight when we paddle our canoe together. We can do this, but we need to do it together. Whakataite le lava, thank you.